introduce one of our finest doctors who is also our vice president in IASRM. She practices at Manas Hospital Campbell in lockdown and also pursued MBBS in year 1997 from Gorakhpur University, and also completed DGO in year 1999 um, in the same school, I think, BRD Medical College, and completed DNB in year 2000 from the same institution, BRD Medical College. Dr. Poonam Mishra is an experienced, skilled, and awarded doctor in the field of her specialization. May I introduce to you our dear Vice President of International Association of Stem Cells and Regenerative Medicine, Dr. Poonam Mishra.
Thank you, Dr. Cheryl. Thanks a lot. And thanks for this elaborate introduction. Actually, yes, this is all just at the outset. Let me first um, thank, I'm very thankful to Dr. Prabhu Mishra, because see, this is something aesthetic, purely aesthetic medicine. This meeting, this seminar, and this is something so close to my heart. I always love to listen to all these like expertise in this field. The recent talk we heard, it was so exhaustive, so elaborate, exhaustive. No, I just mean to say that it completed, it covered each and every aspect of that face correction, and it was so lovely being in between you all, being a gynecologist. Let me tell you very frankly that yes, I am a cosmetic gynecologist. I love cosmetology, but I love to apply this cosmetology in my gynecological practices. Yes, the fact is that we so many times deal with so many patients of PCOD and others which try to get one-stop treatment, and that is why it is sometimes I felt that it is very essential for us, for these gynecologists, to understand and to know more and more about the cosmetology. And that is why I was here. And then I found that I was passionate about threads. And I started doing threads and learned to use threads. Then I started doing body threads, and now I'm doing threads in vulvovaginal region. So I'm very much thankful to Dr. Prabhu giving me the space in this conference, in this group of aestheticians, great aestheticians, and I'm going to present my small presentation on threads for the body contouring and correction. Let me share my screen. Yes. Is it visible on the screen? Dr. Prabhu?
Yes,
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 Dr. Prabhu,
yes.
yes.
Okay. So PDO threads for body contouring and genital aesthetics. Without wasting much of the time, let me start. This is a case which I got the best results on this facial corrections. As we heard, we were told that sagging is more, the nasolabial folds are deep, and when something is remaining, something is missing even after the fillers and the toxins, then only the role of threads come. It is not something as the volumizing effect, the complete volumizing effect, once we have achieved, and then we'll decide that yes, the threads should be applied, and a vector is drawn uh, to go through that line, so that the proper correction, the proper pull, the uh, proper application of given. So about the genital aesthetics, because I use in genital areas for the looks and for the function. What initially used to talk about such a type of decorative ornamentations. Later, the things became much more modern, and now they became, and things are being accepted in that way also. We are becoming much more private. What we get loose vagina. we get disharmony in our life. So fat loss and redistribution, characteristic of the aging, which is characteristic of the aging, is there. What about the young face, which is full with even distribution of fat, appears balanced without demarcation of the cosmetic units. Old face, compartmentalization with the hill and valley, topography and vivid demarcation of the cosmetic units, which leaves the face unbalanced. And the same happens all over the body. And we, being the cosmetic gynecologists, we deal much more. The demarcation is like whatever is above the navel is for the cosmetologists in general, and whatever is there below that line is for the cosmetic gynecologist. So the beauty triangle, we all have heard and we all know, toxins and fillers are great, but something is missing as I was discussing. So how can we achieve facial and body contour restoration? Open surgical techniques were parallel with excising excess skin volume should be added and fat pads repositioned as a minimally invasive technique involving the placement of surgical threads in the subcutaneous layer known as thread lift. We go through the SMAS layer. So the concept is it is a procedure designed or ordinary surgical sutures are passed into the subcutaneous tissues where they rely on the trabecular connective tissue network that run between SMAS and the skin in order to elevate and reposition fat pads affected by ptosis and consequently have a contour restorating effect. Restoration is there because of that pull. I will be discussing later. So two-stage effect is the immediate lifting effect due to the mechanical properties of the thread and lifting effect due to the fibrosis formed by the thread, the secondary vector of pull. So in that way, these two things give the proper effect. Now we are coming to the history. So first generation, catgut, plain and chromic. Second generation threads are polyglycolide, and third generation are PDO, polydioxanone threads. They are highly tensile. They have excellent pliability and they are very smooth during when they pass through the tissue. So how these threads, as we discussed, the immediate lifting effect, and later the foreign body, the thread acts like a foreign body and collagen production is stimulated. Elastin and hyaluronic acid, the own body starts producing this fibrous network around that thread. And in that way, the complete anchoring and pulling effect is achieved. So the functions are, it generates collagen by foreign body material action, increases the microcirculation in that particular area, tissue adhesion and anchoring effect around that foreign body material, increase in metabolism, decrease in cellulite, and the muscle tension, which causes sagging. The muscles become at rest. They come at ease, and that is why the bulkiness is gone with the help of threads. So how long the effect lasts? So first, the threads last, PDO threads last for 6 months to 8 months. So the effect is long lasting. The immediate effect, which is because of the pull by thread, is also going to stay long. The types of threads, they can be like, they are barbed ones and they are smooth mono threads. Mono threads are those which are very smooth and they are utilized for forming mesh down the skin, and that is why they make the skin supple. And the other one is cog threads. Cog threads are barbed threads. We in the gynecological practices and in laparoscopic surgeries, we use these barbed threads for knotless surgeries. We start from one side, we suture and then start from the other side. No knotting is needed because they get entangled themselves. And we utilize this effect for the anchoring effect of these threads. So they could be bidirectionals, they could be unidirectional, they could be like circular, spiral in there. And monofilament thread, As I told, they are utilized for the mesh formation to rejuvenate a particular area, particular or the full face. Barbed, we discussed, spiral, embossing PDOs are also there. They also get entangled. Different sizes of needles are there, and small sizes of threads to the long one up to 90 millimeters are also there. So we are we have discussed that instant effect is there, which is after 20 minutes you can see. Lasting effect is there. It not only lifts but also multiple skin improvements are there. How? We'll be discussing. So the skin is filled up with elasticity because of neocollagenosis, and the microcirculation is also increased. So this gives the shining effect, the whitening effect. For application, this can be applied all over the body, face, neck, specific wrinkles of glabella, nasolabial folds, fine wrinkles, they all can be vanished with the help of these monothreads as well as the cog threads. Breast firming and shaping, hip ups can also be done. Obesity can be reduced at arms, abdomen, flank. Even we are doing in our gynae practices Mons lifting, as I am doing, and vulvovaginal rejuvenation. So different indications are there for wrinkles, for brightening and whitening, for volume reduction, for tightening, firming and shaping, and for lifting. So as in every case, the facial analysis and proportions are observed, and then you decide this, that how much pull is needed, where the pull is needed, and in what way the vectors are to be drawn. These are all subjective, these are all customized sort of treatments. Vectors are formed all over the body. You have to observe and analyze, and then you will have to decide that yes, some sort of pulling is needed. So how do we make? We make a line B to A, the anchoring point and the starting point, the port from where we enter, the entering point. And the thread thickness, thread number, distance between the threads, multiple depths, sewing effect, like so many factors are there. But yes, we try to, as many threads are put, as good is going to be the result. But yes, it is a costly treatment. So many times the patients come and they ask from the very beginning that how much will be the, how many threads will be needed. Minimally, you will have to decide, yes, minimum number of threads which are going to give the best results are these. These are the pictures I have taken from Google. Nothing like, these are not my pictures, but yes, these are just because mesh formation is like this. For every sort of correction, those wrinkles on forehead, on neck, we form meshes. And yes, on body, such designing, even I have tried to do in that way only. Breast corrections in males as well as in females, we design by vectors. And these patients come, many patients come for this arm corrections, like they are happy with their body but they come with this sagging arms, and there also only you will decide, you will feel that yes, some sort of pull over here like this, and that you make meshes with mono and you pull with cog. Abdomen, these are love handles, and there you are making, you are deciding that yes, this shape is to be corrected. So you will be making meshes and pulls also. Brazilian lifts, and for vulval rejuvenation also we are doing, because this gives glistening whitening effect also. So for depigmentation also meshes are being formed, because after aging the wrinkles are formed on labia majora and on private parts. So genital hypopigmentation is also done. This pubic lift, this is Mons lifting, is very nicely achieved. Abdominoplasty is like, just the results are like abdominoplasties. The lower abdomen is pulled up and gives very nice results. I am also doing the introital correction with these threads, and getting a very nice result. So features are what we get. The long-lasting results are consecutive 2 to 3 times procedure results in lasting effect for 2 years. And needling induces wound healing effect. So causes angiogenesis, fibroblast stimulation, collagen induction, improves skin tone and radiance, tightening pores by new tissues, non-premature aging of skin tissue is achieved. It is easy to insert. Minimal downtime is there. Little pain is triggered, and that can be like the patient may take some sort of anti. Actually, we are creating inflammation. So anti-inflammatories we don't try to give, but we try to give potent analgesics. Minimal invasiveness is there, fast and easy procedure, no scars, extremely small incisions, minimal risk of bleeding, applicable to face and various body areas, 100% biocompatible. Use only 100% PDO to ensure its safety uses. And just skipping these are the effects. Microcirculation is increased, it has been shown, and fibroblast infiltration is there. Collagen is created, anchoring effect is there, increased blood flow, muscle relaxation. These are the 4 typical effects which are going to produce maximum results. These are the effects which we get, like mechanotransduction effect. Day 1, when you start the treatment, you are putting the thread inside, you feel mechanical trauma you are creating, necrosis, hemorrhage, and disintegration of fatty tissue. Between 3 to 7 days, there is infiltration of polymorphonuclear neutrophils, macrophage-like, and fusiform or fibroblast-like cells. At 1 week, there is proliferation of myofibroblast and formation of new blood capillaries. So angiogenesis is there. And after 1 week, formation of a fibrous capsule with abundant and dense collagenous fibers. So complications, granulation formation is there, bruises, edema, pain, sense of muscle contraction, skin pulling is there. So in aesthetics or in any sort of procedures, over correction should always be avoided. A little under correction can be topped up anytime. So pulling should not be much. There may be no change, there may be asymmetry, aggravation of problem, there may be visible threads. Cutting, the mechanism of cutting, it's an art actually. You have to pull out the thread and you have to put the scissors and push down and then cut the thread so that it should not be poking out, it should go inside. Dimpling results are there when you become superficial, and that is gone after some time, but yes, you may get if it is not being done skillfully. Contraindications, diabetes, anticoagulants, autoimmune disease, inflammatory skin conditions, and active infections. Advantages, we are told that it is simple and effective, excellent results, minimal downtime. This all has been discussed. Procedure is there should be a consent, yes, and a local anesthesia should be put at the entry point. Better if we take it with epinephrine, bleeding will be less. Insert the needle by right line and right depth. Be careful during insertion and the thread inside the needle. Create volume by fingers before removing the needle. It is pulled before removing the needle. It is rotated also and it is taken out so that it may get cog threads I'm talking about. They should be entangled before taking out. And lift the thread from each side before cutting. Cut enough the ends of the threads. Be careful with the previous threads while inserting. Sometimes the old patients come and threads have been put in, so a little difficulty is there while putting, but it's an easy procedure. Factors determining the success: the design of the thread, material, insertion technique, patient selection, implementation, and combination techniques. Like you are giving toxins first, fillers then, and then decide the good result, the maximum results you will attain, will achieve. Instructions you give: ice packs for 1 day, avoid hot drinks, food for 2 to 3 days, minimal facial expressions if put on face, no massage for 3 to 4 weeks. Conclusion: thread lift bridges the gap between injectables and traditional surgery. Yes, something is there before that traditional surgeries. Combining different threads and different techniques, as well as both anchoring and free floating threads, give the most dramatic results. For the right patient, this procedure can give results similar to open surgery, let me tell you. So few pictures just to show the effect. Yes, the fullness, the color, the texture. These three things which a patient wants is given by the threads. Thank you. I would like to share a video also, so that a thread I just put last year before this lockdown. So this is the patient. I have made the vector and the entry point has been made after anesthetizing. I'm going, a little difficulty is there because she accepted later that yes, there was threads put in 6 or 7 months back and she wanted much more pull. A giveaway feeling is there. Once you go perpendicular, as soon as a giveaway feeling is there, become parallel to the skin. And the fact is that the end point, the anchoring point should overshoot the fold, the sagging part, which is to be corrected. The latest recommendation is that you have to overshoot. Now I'm creating the volume and I'm taking out the threads. It should be the other one for jaw correction. There's a guard you can see. Yes, it gets entangled as soon as it is put inside because these are cog threads. Thank you so much.